Hey everybody, it's once again Leo from Mindful Leo, and today I'm gonna bring you another video. And I thought, why not kick this specific video off with a very nice quote that I've seen recently that I really like, which is, gratitude is to see what is there instead of what isn't. So obviously I hope everybody is doing well, but for those who are not feeling as good, who feel a bit under the weather, that's fine too. I've been through a very prolonged period of quote-unquote suffering myself, and just know that life has its ups and downs and that you can't control that. So if you're in a difficult place, that's totally fine. You accept it and you deal with it, and then the healing can begin. So when it's pretty dark around you, just remember there's probably a lot of things going in your favor, whether it's friends, family, roof over your head, food, drinks. That's so much things that many people don't have. So yeah, you do yourself a favor and your body as well in remembering those things. Well, this is just a side note, and now we're gonna get into the topic of today's video. So today's video is going to be about diaphragmatic breathing, or deep belly breathing as it's also called. So this is overall a very good exercise whether you find yourself in a very healthy state or not, but especially if you're suffering from chronic GI issues, gut issues, or if you generally don't feel like you're in a very relaxed state of mind, which is what we predominantly want obviously in our lives. Then this is a perfect exercise for you to activate the parasympathetic branch of your nervous system and to just get calm and teach your nervous system basically to relax. So this is just a great method to teach your mind and your body to predominantly throughout the day rest and take it easy, because nowadays especially everybody tends to be very stressed out, and our body barely gets the chance to relax, recover, and just be quiet and calm as it's supposed to be the majority of the time throughout the day. So what is this deep belly breathing, diaphragmatic breathing now? Basically, it's a controlled breathing pattern. So this is a very slow breathing pattern as well, where we dive deep into the breathing, we focus on the breathing, and as with most of the breathing exercises we have, it's aimed to basically calm the mind, calm the body, and calm especially the nervous system, which can be considered a link between body and mind. It's all an entity, obviously. There's no separate body and mind. They interact with everything basically. So if it affects the body, it affects the mind, and vice versa as well. So this video is obviously suitable for anyone, without a doubt, but it might be especially beneficial for those who are suffering from chronic GI issues, as I said, for instance with IBS, because the amount of people suffering from symptoms of IBS is very vast in today's world, especially in the Western world, and I am also a person that has had a lot of issues with IBS and related anxiety issues in regard to the gut. So this is very, very beneficial. I'm talking from my own experience. So if you're suffering from IBS or anxiety or a combination of both, this might be a very good place to start. And as I've stated before, the brain and the body are inherently intertwined, especially the gut region and the brain. So if you calm your brain down, if you calm your gut down, it sends calming signals from the gut to the brain, and vice versa. And the majority of the signaling goes indeed from the gut to the brain, around 80%, and just 20% goes from here to the gut. So this is a very, very nice exercise to do if you want to find relaxation that directly affects your brain and the gut and calms them down. And if implementing this exercise into your daily routine, make it a habit before going to bed, right after waking up. I like to do it before going to bed as it winds me down. This is a perfect way to start consciously making an effort to have more well-being, to get a sense of calm into your body, which has been like not there for maybe a year, maybe even more than that, maybe a decade, maybe just some months, but you want to get this harmony between the brain and the gut back. And this is a very perfect exercise to do so. So here are now 6 aspects that this breathing pattern, this diaphragmatic deep belly breathing helps with. And I'm just going to name them for you to know why it is so efficient and why you should be considering implementing it into your daily routine, as I'm doing as well. So first of all, it reduces stress and anxiety. So probably if you're suffering from GI issues, you already know that, but stress and anxiety obviously exacerbate symptoms related to the gut. And therefore it worsens, or maybe is even a trigger for symptoms that are predominant in IBS. Well, this exercise aims to, as I've said, activate the parasympathetic nervous system, and therefore it allows signals to be sent that reduce stress. So it's going to be a calming response to like maybe ongoing physiological stress in your body, and therefore it calms the brain down, calms the gut down, and enables you to get more into this parasympathetic state, therefore alleviating stress and anxiety, which are things that, as I've said, worsen symptoms of IBS or other chronic GI issues. Second of all, it improves digestion. Hooray, who doesn't want that, right? So deep belly breathing activates blood flow, which is then directed to the digestive organs, which makes it easier for the gut organs to absorb nutrients, and therefore ultimately leading to a simpler and easier and quieter digestion. Third of all, it increases gut motility. So this exercise, bottom line, can stimulate the vagus nerve, which is one of the most important nerves in the entire body. It's the main nerve of the parasympathetic nervous system, and it plays a very crucial role in gut motility. And this can therefore alleviate symptoms of constipation or irregular bowel movements, which are very common in symptoms related to chronic GI issues. Fourth, it reduces inflammation. So chronic stress can obviously lead to inflammation, also in the gut. So by decreasing stress through deep belly breathing, inflammation may decrease, and thus improving symptoms of inflammatory bowel disease potentially. Fifth, there's also pain management. So for individuals with chronic GI uncomfortability or pain, deep belly breathing can serve as a form of pain management. It helps to relax the abdominal muscles and therefore alleviates the tension, and this can potentially lead to a lowering of the perception of pain in the gut area. And last but not least, it helps to improve and promote overall gut health. So a regular practice of deep belly breathing can contribute to a better overall gut health. This functions by maintaining a healthy gut-brain axis, which is crucial for gastrointestinal health. So bottom line, if you want to incorporate deep belly breathing into your daily routine, even if it's just for a couple of minutes a day, this may lead to an improvement of an abundance of symptoms and diseases related to the GI tract. So I would say just give it a go, try it out, and after a couple of weeks or even months, obviously you gotta be patient there, because healing is not a one-time event, this for sure. You can implement it and see how it pans out. This would be my advice. And now let's talk about how to do it. So first of all, let's get into a comfortable position. You can either lie down or sit down, and then place one of your hands onto your belly and the other one onto your chest. Right, first thing we want to do is inhale deeply. This doesn't mean taking in gulps, like, no, this is not what we want. We want to do it controlled. Like we inhale deeply, but very slowly. We do it like this. Right, you can't really see it, but we inhale through the nose and notice our belly rising. While doing this, our chest should remain relatively still, as we want to activate this, the diaphragm, which is directly underneath the chest, basically, in the upper part of the belly. And with that, we fill our lungs up with air. Then we exhale slowly, feeling and noticing the air going once again out of our lungs. You can do this through your mouth, through your nose, whatever you like. I don't really mind it either way. And once again, the chest should remain relatively still. And this is supposed to be a very gentle and slow process, right? We don't do it in a rush. We just let the air come out naturally out of our bodies, and we don't push it out. We just let it flow out, right? And then basically this is already it. And then we repeat this process for a couple of minutes, and we focus on the air getting into our bodies, leaving our bodies, and the rise and the fall of the abdominal area. And that's basically it. Sometimes it's very simple, but even more so effective. So let's try it out. Let's get into the practice and see how it goes. Here we go. All right, lovely people. Thank you so much for joining me, and thank you for having listened to the explanation of the deep belly breathing, which we now want to do. So I would ask once again to find a comfortable position. You can do this seated, but it's also just as good to do it lying down. And before we go to the exercise, let's just take a couple of breaths and a couple of seconds to arrive in the stillness, in this position, and settle down and get ready to be for a couple of seconds without anything to do, without any jobs to do. This is time dedicated to ourselves and to wind down and to find peace in the midst of this very stressful world, which is more than necessary. And I congratulate you already for taking the time and effort to take care of yourself, of your mind and your body. Let's breathe gently here, in and out, without any disturbance. And now let's put one hand onto our belly and the other one onto our chest, and feel the touch of both hands, and settle into this position. Now, I want you to gently breathe in to count of maybe 3 or 4. You don't have to count, just as much as your lungs allow you. Breathe in and let the air come out again. Breathe out and in. Fill your belly up with air and let it go out. Awesome, just like that. And go on. Just keep doing that. I don't want to dictate the pace. Just breathe in gently and breathe out just as gently. Notice the rise and the fall of your belly. Notice how the air is streaming through your entire being. How slightly warmer air leaves your body once again. Inhale and exhale. Remember that your chest should remain relatively still while we focus and put our attention to our belly, to the hand on our belly, and notice it rising and falling to the flow of our breath. There you go. You're doing very, very well. And as always, when we do things mindfully, especially when we are doing a breathing exercise like this or just some formal meditation, it's very normal and just natural for thoughts to pop up in your head whether they are of good, neutral, or quote-unquote bad nature, that's really not important here. We just notice them and accompany them out again. They're just thoughts. They are like clouds in the sky. We are the sky, and the sky really doesn't mind if there are clouds. He remains totally calm within clouds. We just let them pass. And in and out. Notice your belly rising and falling. This is a very healing moment. This is a very healing sequence of breathing. We allow our body to rest, our body to restore. Beautiful. And while everybody is wonderfully calm, this breathing exercise slowly comes to an end. And I would like to thank you all very much for joining me today. You're very welcome to remain seated or lying down for a couple more minutes to keep on doing this exercise. You can barely do it too much, and I appreciate you, and I wish you all the best for the future. Hopefully see you very soon. Take care.